My name's Elizabeth. This is my first YouTube channel, so please be kind. I am a registered nurse. I've been a nurse for about 4 years now, and I have done a lot of different nursing fields. I started out in the hospital on a cardiac stroke unit and then into the ICU, and then I did outpatient GI for a few years, then transitioned into a staff development coordinator and infection preventionist. From there, I did a contract with school nursing, and that just finished. I'm currently transitioning into my next opportunity, so stay tuned for that. But I just want to dive in and kind of share what I've done with school nursing and my experience with that. And during my research, I found that there wasn't a lot of information about what the day-to-day looks like as a school nurse. When I first accepted a contract position with one of the public school systems here in Colorado, I tried to do some research and find out, what exactly does a school nurse do? What am I getting into? And I really didn't find a lot of content out there. So this is for you. If you are interested in being a school nurse, these are some of my experiences to hopefully help you make an educated decision if this is the right path for you. In my experience, the main objective for a school nurse was to support the education of the students there at school by making sure that they are healthy enough to receive their education. And I found that different at different schools. I was assigned to different schools, and they were polar opposite in terms of socioeconomic status, diversity, and resources that were available at the school. I had one on both ends of the spectrum there, and it was very interesting to see how administration tackled certain situations in terms of outbreaks that we had at school, and supporting myself, the healthcare provider on campus, making the decisions, whether they supported me or not. So what did I do from the beginning of my day to the end of the day? Well, I think in healthcare, if you have had any healthcare experience, you know that your day-to-day is very different no matter what area of healthcare you are in. That's no different with school nursing. But I would say that the primary part of my day is kind of triaging and charting the students that come in. Both of my schools were very large. One of them had about more than 800 students, and the other one had over 600 students. And we were averaging, I would say, 50 students a day that came into our health office. My job was triaging the students as they came in, helping my health tech with those, assessing them and treating them as necessary with what we had available. What was hard about the job was that we really did not have a lot of things available to us. We had to be creative in how we helped our students come in. For example, a student with eczema came to me one day, and he was having a flare-up and was itchy all over. At least in my school system that I worked, I don't know if this is different in different states or different school systems, but you need a doctor's order even for lotion, even for chapstick. Those are considered medications, and you have to have a doctor's order for those. And so I had no students at either school that had any creams or lotions or chapsticks that I had doctor's orders for. So for an example, for my student with eczema, he came in, I had to call his parent and ask if they were available to come bring lotion or hydrocortisone cream or something to help relieve the itching. So we were very limited on how we can actually help the students in relieving some of their pains and the aches and what they were coming to us for. A big part of being a school nurse is education. Educating staff and delegating to them certain things throughout the day, or for a field trip, or for a student with an inhaler, for our preschool students, the medication stayed in the classroom with them. So making sure that the teachers and their paraprofessionals knew how to handle that, and that they felt comfortable with giving an inhaler or EpiPen in their classroom without having to wait for me to arrive on scene. So that was a lot of the job as well, is just making sure that everyone was educated. And it doesn't just stop with diagnosis or medications. It's also educating everyone on updated CDC recommendations. So another big part of the job was making sure that I was educated and up to date on what the CDC recommendations were at the time for the school year. I had pink eye kind of going around one of my schools for a little bit, and teachers would frantically bring them to the health office and be like, oh my gosh, they have pink eye, we need to send them home. And I had to, in some instances, show them the actual CDC documentation and point out to them the exclusion criteria, and that there was none for pink eye, that we cannot exclude students from school from pink eye. They can still stay on the premises and learn. We just need to be more diligent on hand hygiene, making sure we are washing points of contact that everyone touches, like tables, doorknobs, things of that nature, and just making sure that we are being diligent about really cleaning. Another big part of school nursing, at least in my district, again, I don't know how it is in other districts or other states, but for where I was working in particular, there we had to do IEP and 504 plans. So at least for us, from the nursing standpoint, if it was an initial IEP, meaning the student has never been on an IEP before and we are starting them out on one, the nurse has to do a health assessment. So that will include talking to the student's parents or guardian and getting health information from them from birth to now, like if there were any complications during pregnancy or during birth, any diagnoses the students have had, if they've seen any outside therapies, occupational, physical, mental, and knowing if there has been any impact with any of that in their education, if they're on any medications, if they need any accommodations in terms of helping support them in health-wise at school. And then every 3 years that gets reassessed. So for the initials and the reassessment, the nurses do a health plan in the vision screen. Just making sure those reassessments are just kind of any changes in health conditions from when the initial was done. So those are a little bit easier. And then the 504s are other legal documentation in terms of if we need to have like a healthcare plan for a student, like in terms of like toileting, making sure that they have access to maybe the health office's private bathroom because maybe they have Crohn's disease or something of that nature, excusing them from school or class for medical reasons. So a lot of those things are legal documents that teachers and staff and healthcare providers at the school have to follow. Hopefully that helps give you a little bit more understanding of what you kind of are doing throughout your day as a school nurse. You're helping triage students, you're doing a lot of documentation and educating. It's a lot of paperwork and sitting down. So if you want something that's more up and around, more interactive, school nursing may or may not be for you. I was fortunate enough to be able to just do it for a contract for a few months, just dip my toe in, get a feel for it, and then be able to realize that this was not what I want to continue in. Personally, for me, the biggest thing as to why I am not, why I don't plan on returning to school nursing is that while the job itself was fine, it was great, I loved working with the kids were great, but it was, at least in my own district, I'm not going to say which district I was in, but I was there were a lot of liabilities. Unfortunately, there were not a lot of standardized procedures or protocols that if something were to happen and I was using my best nursing judgment on a decision for a student and for some reason it backfired or there's backlash on it, there's not actual documentation or protocols, like I said, that says, oh, Elizabeth was following this, she is covered. There's just a lot of liabilities, and I was in communication a lot with the district managers about this, and a lot of the answers I would get was just be like, oh yes, we know that there's not a protocol for this and we're working on that. And that was a lot of answers that I got when I came upon a lot of inconsistencies, and a lot of the job was just, oh, just kind of use your best judgment and figure it out, which I'm not comfortable with my nursing license. That's obviously different for everyone else, because there's lots of school nurses that are comfortable doing that in this district, and I was just not one of them. That I was able to feel confident enough that if something really were to happen, that my license wouldn't be at stake. And so that was my experience being a school nurse. I hope this helps. Ultimately, it really was a fun job, but like I said, the liabilities outweigh the actual job itself, that I'm just not comfortable putting my license on the line with that. But if you have any questions, feel free to ask and let me know. If you want me to dive deeper into some of my experience with like how it was working with teachers, paraprofessionals, administration, because both my schools, like I said, were polar opposites, and they were also very polar opposites in how they worked and functioned as a team, and that definitely affected my practice as a school nurse too. So I can dive into kind of the dynamics of that as well. Also, I can dive into what it is with medications and orders, going into more of that stuff as well. But yeah, feel free to hit the subscribe button, like and follow for more information.